still continuing. So anyway, with that said, are there any changes to the agenda?
If any, I'm assuming everybody got the updated one. We aren't going to address the financials in this meeting just because we don't have all the data. So there'll be an update on in the next meeting about the financials. So just in case people didn't get the updated agenda.
Okay. Do we have approval for the agenda?
So move, Jenny.
Second.
Okay, Jenny and Cole. All those in favor of the motion signify by saying aye.
Aye.
Any opposed? Okay, motion carried. Our first item is the consent agenda, which includes the meeting minutes for December 17th, 2025. We have a motion to approve the consent agenda, which includes the minutes. Chris? Do you have a second?
Second.
Cole? All those in favor signify by saying aye.
Aye.
Any opposed? Motion carried. All right, item 2 has a couple items under it. We'll start with the Digby contract, second year. We wanted to provide some updates, kind of I guess, a negotiation going back and forth from what I understand. And we'll have probably Randy update us there.
Well,
Steph?
Stephanie.
Buddy.
That one. Are you there, Stephanie?
Sorry, I was muted. Can you all see my screen?
Yep.
Okay. Digby, we currently have a contract in place with Digby that speaks to the benefits that they provide for a 12-month period. What we're finding is that with the GLP-1s, that the drug duration is a lot longer than just a 12-month period. And so we're looking at that the participants having, 2 years or maybe even 3 years of participation with Digby in order to remain, productive on the program that they're on. But the current contract doesn't specify what the second year looks like. And so we're negotiating with Digby right now to come up with what that fee should be. What they've proposed is that they have an intake fee of $100. Then the kit that's shipped is the kit that basically, they test the biology of your gut, the gut biome. And then the quarterly fees that they charge are if you're continuing to be a participant, an active participant with Digby, then at the beginning of each quarter, they charge $100. So the fee there would be $400. So right now you've got an activation fee of $200, then your kit fee of $400, and then the quarterly $400. So it's $1,000. They're proposing it be $900 on a go-forward basis. What we've suggested is that because this was not contractually explained or put together, that as we go through a transition year, we would ask that they charge $800 based off of the current language in the contract, which would be the kit and the quarterly participation fee of $100. And then after a period of a year from the beginning, we would flip to this new pricing structure where we have the intake fee and app access, which is basically a subscription fee, and then going back to the kits at $400 and the quarterly participation at $400. So we're waiting to hear back from them on what that looks like and how that would move forward. Any questions?
So Steph, is the kit, I'm assuming that's something they get when they onboard, but is that a thing that they do every year then? Is that why that's included in there for the second year?
Yeah, so we actually had a really good conversation with them about this. They want to get, so after you've been on the drug for a year and you've been doing their program for a year, they want to get a new baseline so that the program that you have for the next year is adjusted to the progress that you've already made. So we agreed that made complete sense, and they had to explain it to us though. Yeah, so yeah, we had that exact same question, but wait. And the kit is where they do the glucose monitoring. And it's a 2-week period where they monitor your glucose. And so that's why the kit has to be reshipped, because they do another reassessment of that process. So that's where that's coming from. And so we don't have an actual proposal back from them yet, and we're waiting on that. So at this time, no board action is needed. We just wanted to make you aware that this was what we were discussing with Digby, so that you knew to expect it when we finally get a final decision made.
All right, any other questions? Thought it was important. We should kind of share you an update. It was kind of coming through some different emails, so just want to make sure the board was aware. Any other questions on the Digby contract? See where that ends up. Okay, with that, we'll go to item 2B, which is the Medallis contract.
Right. So if you recall at our last board meeting, Thriver's contract was terminated. And so we've been in negotiations with Medallis to fill in some of the gaps that we have from terminating that relationship. One of those being the registered dietitians. And so we have a proposal in place, but as we're reviewing their proposal, we're trying to figure out how that will fit in with the programs that we already have in terms of Blue Cross Blue Shield North Dakota.me wellness program, how we plug Medallis into that with their additional services that they're requesting and offering. So we'll be reviewing their proposal on Thursday, and we'll come back with a final proposal for the board to review probably at the next board meeting, unless we need something sooner. But that again is just, we're just making sure we're filling in the gaps from the contract that was termed previously with Thriver. Any questions?
Any
In the
question?
meantime, they are servicing through the RD program, so nothing has stalled out or nobody's losing out on services. So just to let you know that. So
It's a great point.
Okay, thanks for the update there. See where that comes through as well. Our next item is 3A, operational strategy. We're going to talk about some things that probably have transpired since we had our webinar with plan standardization for both the January and the October pools, which we had a pretty good turnout for that. So just some, I think, strategy heading forward. So I'll turn it over to Randy.
You want me to take this step, go through this first section?
Yeah, the first part of it, yeah.
Yeah. So we had our meeting back in December. We actually had very good participation. I would say overall, much more with the schools than the political subdivisions, but still it was overall very well attended. And I think all that information in terms of the numbers have been shared with everybody. And if you don't have it or want to see it again, we'd be happy to send it out to you. Those that actually participated on those webinar program or the presentation. The next thing is that getting bids. This is in response to it. So a couple things happened. There was the business manager, I think it's called listserv. Is that right, Angie? There were some comments made after after that event, and those have been, I think, have been seen and shared by a few of the individuals, both on the board as well as the Southeast Education Cooperative individuals. And so we looked at those, that some of the responses and some of the postings that came from the business managers. And there's been a couple comments about getting bids and just to, in a normal, I would say, reaction, and trying to stay ahead of it or just trying to compare, which is fair to understand. We had one group come from Blue Cross or reach out to Blue Cross just last week and say, we would like to get our claims data. And so Blue Cross connected to me and said, hey, are you willing to share claims data? And in the past, we've done that. So we have, it's all their own data. We have nothing to hide or we share it all. And so for the one group. The challenge this group's going to find out, since they're a small employer, we have to be really careful with some of the data, and that's really another question that we should probably think about, because I think it's been seen before, and even on our side, when we see really small groups and we see their data, it's one thing for us to see it because we're on the outside and we don't look at personalized information. But when you get down to really small groups and it goes, then there's a potential of, individuals being able to kind of identify certain things. So just in that process, and the way our procedure is, we do not ever share any data when it's a small group directly with the group itself. We do have a process with Blue Cross where it's just purely financial information. So we're not sharing the diagnosis or procedure codes or especially any individuals. So we will share that just to be aware, but it's only the financial component and their loss ratio effectively. But they're going to find out that when they go through the bidding process or getting quotes, they're going to, and this is something that from a proactive approach to responding to some of these, the idea is to reach out to some of these individuals directly. We talked about it yesterday with Mike, and we all kind of feel in an aligned way that not necessarily that we're saying, first of all, everything they're posting is public. And secondly, the idea is that, we know that they've shared some concerns, and we're trying to maybe address those concerns directly. So we will reach out to these individual groups and help them understand a couple of really important things that I'm going to get to in just a minute on a kind of bullet point basis. So they're going to find out it's going to be really hard to get competitive quotes because of the way that they have structured underwriting now for smaller employers, particularly if you're under 100 or 50, I should say. They put you in what they call age-banded metal rate programs for the most part. They can give you composite rates, but it's really hard. So it's going to be really hard to get singles, two parties, and family rates. You're going to find out they're going to give you age-banded class rates. They don't understand this until they start the bidding process. And I'm only bringing this up because it's important if anybody, contacts you as board members, that you have also some other context for the other side of what potentially they're going to have to go through. The other thing that, since they opted into our program, which is a non-grandfather plan, it's not like you can opt back into a grandfather plan. So they're going to discover that process as well. We essentially adopted the exact same benefits in that added preventative. So we gave a lot of latitude for the member groups coming in to give them the look and feel like, hey, I had my old plan, which they did, and we added preventative under the ACA. So that's another kind of, misnomer, if you would, where they're going to find out that it's not designed exactly the same way that our plan is. We actually have a very rich plan and across the board for all the member groups. But this is just what they have to go through, that they'll figure this out. And those are the really kind of the highlight level. If you go to the next slide, then I'm going to share with you how we're going to approach this. Go ahead.
Cole has a question.
Oh, yeah,
Yes,
go ahead.
I do have a question, Randy. So can we use this to our advantage where if this individual small group is basically soliciting prices and it comes back higher than what we're providing and they were like, oh, wow, you guys are doing a good job. How do you use that to market everybody else? Because it's got twofold, right? It's going to work in our advantage, or potentially it could work the other way. And that's why I'm just trying to figure out what our options are.
Yeah, and this has occurred. We've had a few groups actually bid this last year, and they found out it wasn't what they thought it was going to be. In one particular group, I think it was Valley City, they actually gave notice and they were leaving, and then they got their final rate, and it was like, oh wow, that's not at all what we thought that our rate was going to be, and it was much higher. And they dialed it back and came back. So to your point, the bottom line is they're going to find out it's more expensive across the board to leave. And they're going to find out it's completely different in a structure. And we can use it to our advantage. And when I say that, it's an educational point that you actually have a really good plan. And comparatively speaking, it's also very competitive. So, the next section, though, that I'll give you kind of some additional highlights to give a little bit more context. So I'm getting ready to present to the NDSBA in 2 weeks, and part of my research I'm doing is really trying to benchmark North Dakota cost. This is the North Dakota School Board Association that shows up to this meeting. It's an annual event, and they usually have all the superintendents. I think, Mike, you've been to these before as well as sometimes the business managers attend those as well. But in preparation for that, this is updated information that I'm gathering to share some data points. And this is important because this essentially gives a 5-year history of this is actually PERS, in fairness, and I do have some other slides that I'm not sharing today, but that I'll have prepared for that meeting, but showing the carriers in the market too. But if you look at just the trend for the PERS program, it's been approximately 8%, and the go forward number is forecasted to be over $30,000 on a family basis, which is making it one of the highest in the country. So if you compare because this was brought up actually in one of the posts, like comparing the single rate of what NDPHIT is versus their single, what they think it should be. And so I use this as, kind of a basis to say, well, what is our single rate? This was PERS again right here, and what their increase forecast actually is for 2026. So if you compare this to the next slide, I'll show you. This is actually, first of all, I updated our 5-year composite cost increase over. This was actually a 6-year basis we have kind of an overlap, if you would, between because we had the second pool didn't start till later on. But if you look at our literally 6 years of increases across the board for the pool, January is 5.15, and for the schools, it's 4.72. And so even if we're having maybe even a slightly higher increase into next year, we don't know what that is until we obviously get the final underwriting numbers. But you have to look at really in context over a period of time. And then I also broke down what our costs are for the January pool for singles, for all tiers actually, and then looked at it on a composite basis as well. So the January pool, our annual cost for an employee is $11,742, and our family is $28,634. And this is January 26 too, just so you know. This is our 2026 numbers. If you look at our October pool, it's $10,664 for a composite for a single, and family is $27,558. So this one is actually, if you look at the overall kind of composite weighting, we're still lower than the NDPHIT groups at 13.78 as a total pool lower on the single rate and 8.62% on the family rate. So 2 things going on here. Not only do we have a lower composite rate, but we also have a lower trend. So I'd take 5% on a lower number than 8% on a higher number. And this is really important. And so trying to provide context for all this and education is it's the key. Otherwise, you knee-jerk or you assume things or you don't really understand. And I think in some cases, it's maybe a little bit of all of it combined. They don't understand. And because they don't understand, they're being kind of pushed by maybe our asked questions, that being the business manager, since they don't understand, it's like, well, take it out to bid. That's the first response. Take it out to bid, as opposed to really saying, where are cost? What's the analysis, if you would, that justifies or at least gives some context for the comparative process? So if you go to the next slide. So that's number one. We're going to give that history. And the next thing is, what are the points in this proactive educational approach? And that is the why behind the increases: national and local drivers, prescription, high cost claimants, and small group underwriting. And that's, those are, we're going to highlight some of it, give a little bit more information when we do this education with them. And then it's the inevitable shift from grandfathering. Grandfathering plans are just a thing of the past, simply because it does not provide any flexibility, and you get stuck. And you get stuck in your thought process to it, as well as in your plan design and your benefit value that you can really deliver for the employees. And then the other thing that we realized is we just have to give some really healthcare plan basics. What is a copay? What is a deductible? And what is the out-of-pocket maximum? This is not uncommon for this group, just so you know. We have, I think 8 larger self-funded schools that we manage throughout the state. And we're working at one we just took over is Minot Public Schools. And we have an insurance committee meeting in 45 minutes or 40 minutes. And this is one of the areas that we realized, okay, we have to start backwards. It's like the very basics. And so we know if they don't understand this, they don't understand. Sometimes they don't have any context when we share we're changing that out of pocket, and the fact it's only going to have a minimal effect. And the other advantage we have is, since we do have their data, we can share percentages to their group of how many people it's actually going to affect. That's really important. So when we're making these plan changes or the out-of-pocket changes, we can say, do you realize, it's this percent of your entire population? And it can be specific, even if it's a 10-life group, because that's what they'll be thinking of. How many people in my group are going to be affected? Most of the time, they always go, everybody. So we're going to share that as well. And then what is the proactive approach to cost containment? If this is our challenge, what is our strategy? And we're going to give kind of a highlight of 4 or 5 areas that we've made as a proactive approach to cost containment with NDPHIT over the years. The reason we're operating in a lower trend, the reason we have a lower cost for an employee in a family composite, there is a reason for that. Even though we're faced with what we shared the last month, overall, if we hadn't done those things, we would be, even if we were even to what the state PERS is, it would still be worse. When I say that, it's because we know what our forecasting is. So we're starting with a lower basis, but we're forecasting, we're still doing some very positive things. So why NDPHIT? And then we're kind of summarizing on this with those groups, and that is premium stability. We've shown it. Here it is. Financial and rate renewal transparency. You will know what your rate increase is and why. You will not just get a letter in the mail saying your increase is X. Comprehensive and flexible benefits. That's another important thing that we'll share, just in terms of the actuarial value, and the fact that we provided some administrative flexibility or kind of support to help you manage this in a much more effective way. The wellness incentives that we built in, as well as the valuable vendor partnerships that we have. So that's kind of the proactive way that we're going to approach this. And we thought, in discussion with Mike and collaborating for this meeting, that we'd at least give the board some context to how we're going to respond, and then also how we're going to educate as we make this transition over the next year to year and a half into the standardized plans. So with that, I'll just stop there and see if there's any questions.
And then I think you said this, just actually reaching out to those that had the questions is kind of a next step or something like that, right? Or we were going to handle that in their individual consultation, or we're going to just do them all at once, or.
Oh yeah, we'll probably do them one at a time. Yeah.
Yeah.
It's best to just say, reach out one individual at a time, because we know we're going to have to do that anyway when we're doing the rate renewal and showing them their options. So we thought, okay, with these individuals, we just making sure that they feel like we care about them individually, but not only that, we're going to help them individually.
And so just as you think about that, sooner than later, would that be the?
Yeah. We're gonna talk internally as as a follow-up to our discussions yesterday and today, and then work on a kind of a time frame to get with each of these groups that did make any comments.
Sure. Jenny?
Yeah, I just want to piggyback on what Cole said in regards to these groups that are, like Valley City, and not that you need to name who they are, but I do think it is important. I mean, I think one-on-one you can share, when they're maybe looking someplace else and then coming back and going, oh, wow, this isn't what we expected. But is there a way that we can market that? When you're meeting with the School Boards Association to say, I know change is hard, and kind of going off of that piece. And it's, it's a little unnerving when you're making changes, but what we found when we've had people that have looked to leave the group, and we, if that's something you want to see, but that at the end of the day, when they saw what their rate increases were going to be, they were getting less of an insurance coverage and benefits and higher rates. I don't know how you can.
No, that's a good point. We can certainly highlight some of those, the individual groups, as well as there were some actually positive comments that came on the listserv too as follow-up. People say, hey, it's not quite what you think it is. And they came from groups that are on NDPHIT.
Mm-hmm.
So we'll highlight some of those as well. That's an excellent point. We can certainly refer to those groups, and because that does provide some kind of strength to our conversation that we're having about their own group.
Because we have some groups that are bold enough to say that they're doing this, but how many are sitting in the crowd thinking about it?
Yeah, that's true
and
too.
Maybe sharing some of those things might deter them, or give them a little bit clearer picture on what they may find out. Anyway, just some food for thought.
Okay, that's good feedback. So this is yours, Steph.
Yeah, so we just wanted to reiterate that, the timeline was confirmed. We actually rolled that out to the groups after the December webinar, because in December when we did the webinar, it was a tentative, and then the board met and decided that would be the rollout. For the next steps, we just talked about the feedback that we've received. One of the things that we would like to do sooner rather than later, and this is not related to one-on-one, this is related to a webinar that would give basic education, because I think one of the things that we're finding is that, some of the feedback that we're seeing are things about, wow, they're trying to increase our deductibles. And it's not a deductible. Most of the deductibles are zero. There's no deductible whatsoever, a $250 deductible or a $500 deductible in the plans that were offered. And that, those are unheard of nationally. And so education about what a deductible is versus what actually the maximum out of pocket is, and what dollar amounts accumulate to each of those buckets, and then how coinsurance works in conjunction with the deductible and the out of pocket maximum, as well as the copays. So just getting basic plan design information into the hands of the employer groups. And what we'd like to do is just do, like a plan design 101, and then take like one of the most utilized plans by the NDPHIT member groups and compare it to one of the standardized plans. So taking like the $250 deductible with the $3,000 out of pocket maximum and comparing it to a plan design that would map over to that rather easily, another $250 deductible plan. So we can show them exactly where that impact would be. I know we've already had several groups reach out directly to us with questions about that. And I walked one group through where I said, you've already got a $250 deductible. You've got a $2,500 out of pocket maximum. It's a $500 difference between the plan that you're on and the plan that you'd be moving to. So, just understanding those little elements, they just aren't, they don't have the depth and the breadth and the experience with working at the plan design level that we do. And so we'd like to give this information to them to help to better understand what it is they're looking at when we get to the renewal call. And then the rest of the slides are just the same slides that we presented in terms of what the plan designs actually are and what they look like. And so what we would do is take like plan 1 with the $250 deductible and the $3,000 out-of-pocket maximum, walk them through a scenario of you would have to incur X amount of claims in order to even reach the $3,000. And using the high deductible health plan as an example as well, and use that in our education webinar. And anyone can join, and we'll send it out to everybody if they don't get a chance to watch it.
Beth, is there a way that you can show who's already in a standardized plan? Because it goes back to Jenny and I's comment earlier. We all talk to each other, like all the parks people, any question they have with any changes to their insurance, they're calling me asking questions what we've done. And I'm sure on the school side, they do the same thing there on the backside. But is there a way to show who's already done it so that way they can ask the questions and maybe jump in earlier?
We can, but I guess I'm wondering, so we can share this school already has the standardized plan design, but do you want them to actively participate in the webinar?
No, I think they should
Okay.
participate in the webinar. What I'm trying to be able to say is during your PowerPoint, hey, we got
that's a good point.
30 groups that have already jumped into this standardized plan and it's working well. And if
Okay.
I'm sitting on
Yeah.
the fence going, should I do it for this next
Absolutely.
calendar year or do I wait another year? If I see people already jumping on, I can call them and then jump on and get more people on sooner than later.
Yeah, sure. Absolutely. Absolutely. And we offered that up in the December webinars too, that we had people who had already made the plan jump and they could, offer up their experience on the calls as well. But that's why I was asking if you wanted it to be like that, where they were able to jump in and offer up their experience. But no, just letting people know that this many groups have actually made the jump, we can easily do. Yes, that's a great recommendation.
And I think public entities are, I'm not speaking for all of them, but a lot of them are very active and they listen to smart people like Michael.
I'm sorry, my network is cutting out. I cannot hear what you just said.
No, it seems like a lot of public entities are very reactive.
Oh, yeah.
And so they look to smart people like Michael and other people in this call. I don't want to sell everybody out, but just kidding. But they're very reactive because they don't have the knowledge or the experience to be able to find out this information. So as it's kind of a snowball effect that I've always seen is one does it, next 3 or 4 do it, then next year. So that's why I think they take that experience from us.
Right. I think that's a great idea.
And it might even be helpful, like once we start getting, could you put the school district, the political entity on, okay, this group went with Plan 8, and then their, Rugby school district's there, Belleville Public School district's there, and then, then it allows people to like, oh, okay, I'll maybe do that.
Yeah, absolutely. We can do that. Yeah. So when I'm going through, for example, let me just to make sure I'm understanding. So as I go through and compare the 253,000 to someone who's not on it, I can say, and this many schools are already on it. Yep. Perfect. Any other questions on plan standardization before we move to the any questions? Okay. So then if you're all right, I'll continue with the operational strategy and talk about the committee meetings. We've not had a committee meeting for a minute, primarily because they were focused on the plan standardization. So now that that's all been decided, the plans have been finalized and the strategy has been moved forward, we have a list of initiatives for consideration for the committee. But the question is, do we want to set up meetings and move forward? What is the next step?
So I think what we talked about in a call to kind of prepare for the meeting, everybody is that, I don't know what the strategies are because I don't live in the healthcare world other than just serving on this committee. And so one of those strategies was plan standardization, which we know is a big lift. And so then it's kind of like, okay, well, what's the next thing that, always trying to, as Randy, I think, and Steph always talk about, just kind of, you're playing chess here. What's the next strategy to reduce cost and, in a way that, is good for the membership and all of that. So we asked Brown and Brown to come up with a list of things that, all right, what's the next thing we need to kind of look at just to kind of keep ourselves always, moving forward to, obviously supporting our members appropriately, not reducing, benefits as we can, and, kind of reading the industry and all of that. So that's kind of where we're at. So it's sort of just making progress, moving forward, and, in a way that isn't, over the top. I think that's the other thing, is just making sure we're not like doing too many things that, complicate and make people confused. And, so I think that's kind of what we're talking about.
Yeah, so we put together for the committee initiatives for their consideration. And then I think the board had voted that the plan standardization was the priority, but now that that's behind us, we've got financial initiatives we can consider, we've got service offerings, we've got customer service, communication of NDPHIT initiatives is always on the list and always will be. So we've already highlighted that that's working in conjunction with anything else that we do. One of the other things that we had hoped to look at, and this is kind of along the same lines, is we do know that your Trans-America GAP programs are going to be given a rate increase in 2027. So I would recommend that we take this one out to bid at this time, so that we're prepared for that renewal increase in 2027 and we have competitive bids. So what we would need from the board is just your permission to be able to take the GAP program out to bid in order to get competitive quotes. And then you can decide if you want to have the committee review those quotes, or if it's, cut and dried, if you just want to make a simple decision at that point. But we would like permission, knowing that the rate increase is coming, to be able to look at other vendors for this product, just for the leverage.
Angie, were you going to say something?
Nope.
Okay.
I just went off mute just in case I needed to with the vote or anything.
Sure. Okay. So the previous items Steph shared were just things that, we'll review within the committee, of course, bring those forward to the main group when we need to, and for approval. The main item here they're looking at is, again, for approval for to be able to bid the GAP plan, right?
Mm-hmm.
Yep.
So do we have a motion for that?
Sonia will motion it since I was late to the meeting.
Okay, Sonia, we have a second.
This is Desi. If you can hear me, I'd second.
And Desi with a second.
Gotcha.
Any discussion? Any discussion? All right, all those in favor of the motion signify by saying aye.
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 Any opposed? All right, motion carried.
Thank you.
Okay, I believe.
So then I guess the question is, do we want to pick a date for the next committee meeting to review the initiatives, or are there initiatives the board has in mind?
I think what we were talking about was I'll do a doodle poll for some days in February, and then see what works for the committee members. I think that's kind of where we were at after the meeting yesterday. So.
Okay.
Angie, I don't know if you know this question, or I asked Michael too this question, but when does his term end and my term come on as president-elect? Because all these things that are going to happen, and I don't know if I need to participate to get a little educated, so when that changeover happens, I kind of know what's going on. I'm just curious when that date is.
Well, technically, so we extended it. It used to be a 1-year term, and we extended that because after 1 year was just not enough. You're just getting your head wrapped around it. So it's a 2-year term. So yours would be January 1st of 2027 would be when you would take over then. So.
All right, keep me off all those committees then.
Well, that's actually why they voted to make it mandatory in that year, not this year, Cole.
Okay, so we've got a doodle poll that will go out. We've got, we're talking about combining the February and March meetings just because of timing. and we're throwing out the second weekend of March, possibly the 11th. And then we would just combine those two meetings. Is that correct?
Well, it was just a question of if that's what we want to do. Do we still want to have February's meeting and then just move March's up to the 11th? Do we want to just combine them into one meeting? It was just because at first when we were first talking about it, it was kind of like the last week in February, and now we've kind of pushed it to the middle of March. So it's just a question of, do we want to have the February 18th meeting as normal and then just move the March 18th meeting up to the 11th? Or do we just do one in the middle of both of them? So it was just kind of what's the board's or what's their preference.
I think it seemed like we could, just because of the items we've got, that we could merge and not have a couple meetings and just do one. So I mean, I would, unless somebody's got some strong opinions, but we're looking at March 11th. I believe the time was, were we thinking 1?
Yeah, we were thinking of just doing the same time. So it would essentially be the same time. It would just be a different Wednesday in March than normal.
Any strong feelings or?
No, I think that sounds great.
Okay, so we'll get a calendar invite from Angie, I would assume, for March 11th.
Yep.
Then we'll get a doodle poll going for the committee to look at some other strategic initiatives. All right, I think we've come to the end of the agenda. Unless there's anything else for the good of the order.
I apologize. We're switching over to Infinite Campus and I had to overlap meetings. They're working on the payment part of that Infinite Campus. So I apologize. I was late to the meeting. Angie, would you be able to take a phone call from me to just go over the discussion I missed out? Or I guess maybe Stephanie, of the portion that I talked to you about earlier, Angie, in emails. I apologize. I tried getting out of that other one, but I was literally talking, so I couldn't.
Nope, that's okay. I can
that
just give
okay?
you a call. Yeah, I'll give you a
Okay.
call when we're done.
Perfect.
Yeah.
I
And
appreciate
if you
that.
need me to join as well, Angie, I'm
Okay.
happy to. Just
Yeah.
let
I
me know.
appreciate that so much. Yeah, because I'm part of that. And you probably already told everybody that, but yeah, I'm part of the business manager listserv, and there was just a lot of and I was looking, some of the schools that were negatively commenting have attended. I looked at your list. So I would like to visit with you, Angie, quick, just to recap that. And Stephanie, if you want to jump on. Okay.
I'll just send a Teams invite to the three of us or to both of you.
Perfect.
Okay, thanks, Angie.
Thank you so much.
All right, anything else? Take a motion to adjourn the meeting.
Chris, I can make a motion.
Chris? Keith's looking around, looks like he's the second.
I will second. Yes.
All right, we are adjourned. Thank you guys. Have a good day.
Thanks,
Okay,
everyone.
thanks, everybody.
Yeah, stay